Good afternoon, everyone. Thank you for joining us. I'm Lawrence Smith, Executive Vice President and Physician-in-Chief at Northwell Health and Dean of the Donald and Barbara Zucker School of Medicine at Hofstra Northwell. I also chair the Roundtable on Health Literacy at the National Academies of Sciences, Engineering, and Medicine. I welcome you to today's webinar, Addressing COVID-19 Misinformation through Health Literacy Practices. This webinar will explore the rise in health misinformation with COVID-19 as an example and the potential for health literacy strategies to be used as tools for addressing health misinformation. This webinar, hosted by the Roundtable, comprises health literacy experts from healthcare, pharma, community-based organizations, and other fields. We convene meetings to share promising and best practices, cutting-edge research on health literacy around a specific topic or issue. Some housekeeping. This webinar is being recorded and will be archived at the Roundtable website, nationalacademies.org/healthliteracyrt. I would now like to introduce the moderators of this webinar. We are very fortunate to have Ruth Parker and Lori Myers as moderators of this discussion. Ruth Parker is a professor of medicine, pediatrics, and public health at Emory University. For over 2 decades, she has partnered with patients to help figure out how to better align health and healthcare demands, complexities, and information with the skills and abilities of everyone needing to know and understand how to get and use what they need for their health. She is recognized for research, education, and health policy efforts to advance health literacy and views the lens of health literacy as foundational to understanding and promoting patient-centered research and care. She has co-authored the Test of Functional Health Literacy in Adults and the Definition of Health Literacy used by Healthy People 2010, 2020, the IOM, and the NIH. She's a former member of the Roundtable on Health Literacy. Lori Myers is the Global Health Literacy Director for Merck. She leads the company's health literacy efforts in support of improved patient communications about clinical trials, medication, disease education, and packaging. She is passionate about diversity and inclusion, and health literacy is a tool to address healthcare disparities. She advocates for policy change to make it easier for patients and their families to understand information about clinical trials and medication. Lori earned an IHI Health Literacy Research Award for efforts to include people with low health literacy in market research and to confirm their understanding. She was named a 2018 Medical Marketing and Media Top 40 Healthcare Transformer. She is a member of the Roundtable on Health Literacy. Now I will turn the meeting over to Ruth, who will be moderating the discussions with our first 2 panelists. Ruth?
Thank you, Larry, and thank you to the Roundtable members and to Rose and Alexis for organizing this webinar. Start my video. Sorry about that, guys. I had to reread a slide there about starting the video. I apologize. Anyway, thank you, Larry, and thanks to the Roundtable members and Rose and Alexis for organizing this webinar on such an important and a timely topic. I'm delighted to be a part of this, and I welcome those who've joined us for what I expect will be a very good session. As a reminder, we do encourage you to submit questions using the Q&A function, though I can't promise we'll get to answer all of them during our discussion. We did have a couple of 100 questions submitted during the registration period, and we worked with our panelists to incorporate some of those into what you'll hear presented and discussed with them during the session. I know members of the Roundtable, as well as many others committed to health literacy, know and value the fundamental importance of trusted sources and content of essential health information. Indeed, health literacy relies on and must have at its foundation up-to-date evidence that's communicated across various media so that everyone can find it, understand it, and use it for their individual and community's health. We also note that it is both an art and a science to clearly communicate uncertainty, what we do know and what we do not know. Misinformation and disinformation are growing real-world challenges, and we see their relevance to how we navigate this current pandemic. It really is an honor to be here with some terrific panelists who are going to try to help us understand this and also offer us their insights into what those committed to health literacy can do to help us through some pressing, challenging times right now. Our first panelist is Kate Starberg, and we're going to ask her to help us by framing the conversation and explaining to us a bit more about misinformation. Kate Starberg is an associate professor in the Department of Human-Centered Design and Engineering and director of the Emerging Capacities of Mass Participation Laboratory. She's also adjunct faculty in the Paul G. Allen School of Computer Science and Engineering and the Information School, and a data science fellow at the eScience Institute. Kate's research is situated within human-computer interaction and the emerging field of crisis informatics, or the study of how information communication technologies are used during crisis events. Her research examines how people use social media to seek, share, and make sense of information after natural disasters and man-made disasters. More recently, her work has shifted to focus on the spread of disinformation in this context. Kate's research touches on broader questions about the intersection of technology and society, including the vast potential for online social platforms to empower people to work together to solve problems, as well as salient concerns related to abuse and manipulation of and through these platforms, and the consequent erosion of trust in information. Well, Kate, thank you so much for joining us. I'd like to begin our conversation with you by having you help us understand a bit more about the difference between misinformation and disinformation and how we should see and understand these.
Yeah, I think especially in the context of crisis events, we see a lot of different kinds of misinformation. We see accidental rumors, we see misinformation, and we're increasingly seeing what we're talking about as disinformation. And the difference between misinformation and disinformation is really important when we think about strategies for addressing false information online and other places, and for just understanding. And so misinformation, the way we're thinking about it, and these definitions are actually they're being contested, and we're still working it out as a sort of emergent field of studies of disinformation. But the differences, as we were explaining them now, are that misinformation is false information, but not necessarily intentionally false information. And disinformation is false or misleading information that's seeded or spread for some kind of intent, usually a political intent or sort of political objective or a reputational objective or a financial objective.
So in other words, we should think of disinformation as not just simply false information, but move beyond to think about the intent of what was there.
Indeed, and as we do that, we have to think about sort of not just looking at the content of an individual piece of information, but look at disinformation isn't just one piece of information, it's also part of a campaign or a set of different narratives or different things, and it often builds on factual plausible core and sort of layers false information around that or takes it out of context to spread it. So it's not as simple as saying, okay, that piece of information is true or false. It's actually, why is that information spreading now? Who's spreading it? And what are the intentions of spreading it in this context or that context? It really makes the challenge of identifying false information and removing sort of malicious information much different than just this kind of fact checking of something being true versus something being false.
Big, important distinction. Thank you. So how do we become aware of misinformation and disinformation?
So one of the things I like to say here is that misinformation doesn't spread itself. We spread it, we being everybody who participates in these information spaces nowadays. And we as humans are particularly vulnerable to spreading misinformation during crisis events like pandemics, due to the uncertainty of the information space and the anxiety that we feel about what we should do about it, how it affects us, et cetera. So misinformation and disinformation sort of leverages that emotional response of anxiety or fear or outrage to get us to make that decision to share it on. And so, my brother called me early in the pandemic period to tell me about this lockdown was coming and I needed to go to the grocery store right away. And my brother rarely calls me to talk about information. We talk other ways, but he was feeling anxiety. He's feeling anxiety for me, and he passed what turned out to be a false rumor along to me. And you can see that these emotional engagements become part of our vulnerability to sharing misinformation, disinformation, and particularly nowadays, our sort of political outrage gets kind of invoked as part of these like online discussions, and kind of motivates people to push that reshare button or that tweet button, and is part of why this information goes viral.
So Kate, we had a lot of people who sort of ask about in their questions during the registration about, red flags or whatever. How do I know? So what you're really underscoring is we need to take note of how we feel.
Yeah, so the history of sort of media literacy has often been concentrated on sort of logically looking at the information and okay, where's the source, who's that source, and all these different things. But where we really think about when we're being manipulated, it's not coming up here, it's coming through our guts, right? We're being manipulated through our emotions to share this information. And one of the things we tell our students and others is to really tune into your emotional response when you're seeing a piece of information. And not that you have to say, oh, because I'm emotional, I can't share it. Sometimes it is, you feel outrage and you should share it, but just reflect upon that emotion, why you're feeling that, why that information might want you to feel that, and think about that, and maybe slow down a little bit before you reshare something or pass something along.
So I've heard you speak before. Could you share a little bit about your thoughts about science and its evolution and uncertainty, and how that really plays into what we're seeing right now with COVID and the pandemic and misinformation?
Yeah, from the literature and sort of crisis informatics and back to the social psychology of rumor during crisis events, we've had these theories or understandings that one of the reasons we often see misinformation and rumoring and false rumors during crisis events has to do with the uncertainty of what's going on. Like, we're not sure what the impacts are. We're not sure what actions we should take. And we have a tendency in those situations to kind of come together, try to gather information and try to make sense of it and theorize about it. And often those theories can turn out to be wrong. But sometimes they do turn out to be right. So that theorizing and collective sense making actually serves sort of psychological and informational purposes during a crisis event. The thing about the pandemic that we're experiencing is this uncertainty period isn't just 2 or 3 days like it sometimes is for an earthquake. We're getting months of uncertainty, and it's scientific uncertainty, and things are changing underneath us. The best understandings today are very different than the best understandings last week or a month ago, and certainly 3 months ago. And those changes, first of all, the uncertainty makes us uncomfortable, but then the fact that things change and we have to update our mental models about things, a lot of us aren't very good at that. And that makes us even more uncomfortable. And then that can even play into people that might want to spread a certain kind of narrative to say, oh, look, the scientists they told you one thing, now they're telling you something else, they must be lying to you, right? And so they use, people that might want to manipulate us and spread disinformation can use the sort of natural process of updating a situation during a time of uncertainty. They actually can spread a false narrative or create a false narrative and spread it to undermine science altogether and just keep that uncertainty, make it even more confusing situation, often for some other objective, like a political objective or something else. And we're seeing a lot of that right now.
I think it underscores that we as humans struggle with uncertainty. Scary, it makes us feel a certain way. And that as a climate, if you will, right now with a novel, new, we're learning, and our ability to help everybody understand that what we know changes and evolves. And, you know, which makes, okay, so what do I trust? And when do I trust it? And how do I know? Even more of a real world challenge right now. Really.
Yeah, no, it's, we're experiencing something that is, you know, it's all too natural. I mean, when I first started seeing that this pandemic was happening, and I know the literature, and I'm like, oh, this is going to be, you know, there's going to be a lot of rumoring and misinformation, and just because that's the natural way that we deal with these things, because they make us very uncomfortable. What's unnatural is that this is now, maybe not unnatural, maybe this is natural as well, but it's intersecting with just sort of pervasive politicization that's already in our information spaces, and the pervasive spread of disinformation and the use of these techniques. And so not only are we sort of naturally grappling with this stuff, which was going to cause us to make mistakes and things, but on top of that is there's folks that are willing and now very able to manipulate that anxiety and that uncertainty for their own objectives. And that is definitely making this an even more complicated situation. And perhaps at this point, we can even start theorizing about how that is costing lives in the United States.
How do we on the ground, sort of the common people, how do we think about misinformation and disinformation? And should I think about those differently? I mean, should I approach them differently, or should I'm sure you as a scientist and somebody who studies it probably does, but what about the rest of us?
I mean, it's difficult because as we think about what disinformation is, it means that we have to assess intent. And intent is a lot harder to assess than is something true or false. And even the platforms themselves who have tried to develop policies about the spread struggle with that distinction. It's much easier to say, okay, I'm going to have a fact checker say whether this is true or false, versus, you know, I'm going to, you know, try to assess the intent for why that particular narrative is spreading out of context right now. And so I think it's really important for us to understand it, but it's also really hard, and we need better tools for understanding that. And when I think about social media platforms, we need better cues from them to be able to assess intent. We need better information about where the information we're seeing is coming from. We need better information about how it got to us. We need, you know, better cues about, okay, that website actually has spread these other 5 things. So you probably should be a little bit worried about their intentions. And so I think we're absolutely, to be savvier participants in these information spaces, we need to be able to understand this difference between misinformation and disinformation. But we don't have the resources yet as users of these spaces to be able to make assessments like that. And we really do need help. And I think that's a platform design problem as much as anything else, as well as an education problem. We need to better understand these things and come up with and learn strategies for addressing them.
Oh, what do you think the scope of this is? How big a deal is this?
Oh gosh, you're asking a person
really
who studies this all the time. Of course, it's the biggest thing in the world. It's the most important problem.
Well, that's what I said about health literacy for a few decades. Many have heard me say that. So,
you know, in 2013, we were studying rumors during crisis events, and we saw some of this disinformation happening. And it was conspiracy theories that seemed to be sort of selectively amplified for political objectives. And I thought, boy, that's so marginal. Let's not even look at it. By 2000, you know, and I didn't want to be the researcher that goes and studies conspiracy theories. I didn't want to be giving talks about them or seeing my email after giving talks about them. But then 2 years later, we began to recognize that, you know, the rumors and misinformation, yeah, those were out there after crisis events, but the disinformation was becoming a bigger and bigger part of what we were seeing. And there was infrastructure, network structures, connections between accounts that habitually spread this stuff that were beginning to reshape how information moved in these information spaces. And I think increasingly we have plenty of cues to say, you know, this is a really big problem. We're seeing disinformation come out of the mouths of leaders, political leaders, not just in the US, but all over the world. And we're seeing it, you know, show up in what we would have previously considered mainstream spaces. And so I think as we see it moving from the margins to the center of the conversations, I think we can recognize it as a pretty significant problem.
Yeah, I think you underscore in the work you've done that it is with disinformation, it really is a campaign, and the intent of it is very specific. I might ask you just to close. I was impressed hearing on some talks I listened into that you did about how it really undermines democratic societies. You know, if you don't mind, that'd be helpful.
Yeah, so one of the growing theories about disinformation, and we're not sure whether it's an objective or just an outcome. So disinformation does have some connections. The techniques do have some connections to Soviet active measures and intelligence operations. It's been outsourced now. All sorts of people are using disinformation. It's certainly evolving. But one of the theories about the outcomes of disinformation is not that it just changes somebody's mind about some topic, but it increasingly sort of disrupts the social fabric by having people move apart from having a shared reality, where people increasingly believe things and other people are like, that's just not my reality. And also they begin to lose trust in information providers, in government, in science. That's part of the narratives that help to push disinformation, is often distrust in science and others that we would have previously looked to as information authorities. And what that does is it makes it so people can't come together on the common ground that we need as a democratic society to come together on to govern ourselves. And if we can't come together around some shared reality, then democracy kind of falls apart. And on top of that, we're seeing disinformation directly attack our faith in the election process and further just kind of erode our trust in the institutions that we need as a democratic society. And so there are some theories that you know, some days I buy into them more than others, but they're really dark about what the long-term impacts of pervasive disinformation will be on our society, which definitely make that earlier comment about it being a significant problem. It really does seem like a potentially really damaging situation for democratic societies.
Well, thank you for the good work you're doing and for joining us. I think your comments about the erosion of common purpose are so incredibly important and relevant at a time when we all are very aware that to navigate the uncertainty and the trials of a pandemic, we need common ground. So thank you so much for the good work you're doing. I'm going to turn now to introduce our next speaker. And I do have the pleasure of introducing to you the next discussion, who is Nat Genius. Nat leads the Meaden's Digital Health Lab, a public health research unit focused on technologies to support more equitable and stronger health response and communication efforts. She's a research affiliate at Harvard's Berkman Klein Center, examining ways that the health information we encounter online impacts disease distribution and the ways in which machine learning approaches can be used to fact check information and strengthen public health systems. So welcome, Nat. Thank you very much. And I apologize if I butchered your last name. I'll apologize ahead of time. Welcome.
You did a great job. You did a great job. Thank you so much for the intro, Ruth. It's a huge pleasure to be in company with such brilliant researchers, and I appreciate all of the participants in the room for choosing to spend your day learning alongside all of us. As Ruth mentioned, I'm Nat Genius. I'm a public health researcher by training, and I direct the Digital Health Lab at the technology nonprofit organization Meaden. And we work directly with social media platforms and search organizations to try to strengthen what we call information equity on the internet. So a specific project that I'll dive into a bit more deeply later on in this presentation is a project called the Public Health Expert Database that we've been working on, where over the last 6 months, we've built a team of infectious disease experts, health literacy practitioners, epidemiologists, pandemic preventionists, and vaccine adoption researchers to work directly with fact-checking organizations, as well as local newsrooms, in order to provide on-demand contextualizations for the latest scientific research related to the pandemic. You can learn more about it at learnaboutcovid19.org, and I'll touch on it again a bit later. But I'm going to emphasize a specific key opportunity for the public health community to contribute to existing technology-based interventions that are working to address health equity at the scale of the internet. Next slide. So through my research that we've conducted at Medan's Digital Health Lab, it's become clear how important it is to ground health misinformation response work and this field more generally in the reduction of stigma. So I'm wondering, I know we can't have question and answer responses directly here, but I wonder how many of you have come across health myths that have been labeled as outlandish or ridiculous or crazy or silly. And I know that it's a difficult balancing act to try to reduce the negative impact of health misinformation while ensuring that we maintain a safe space for our communities to ask questions about health myths. So I like to start by sort of leveling the playing field. And I like to start that by highlighting one health myth that I carry with me, even as a scientist, as a health misinformation researcher. It's information that I know to be false, but it still embeds in some of my behaviors. And mine's about touching my nose. So when I was growing up, I was told that if I touched my nose too much, it would start to grow. So now I have some habits where I end up touching my nose and I still feel that sort of anxiety, even though I know it's not true. And some of my colleagues, even ones on this panel, have highlighted health myths that they know to be untrue, but still carry with them, such as eating garlicky greens to boost immune systems, picking the seeds out of watermelons to prevent little gardens from growing in our stomachs, or applying papaya ointments to cure anything. And again, these are all false, but what we start to do here is sensitize ourselves as health communicators and at the health literacy community more generally to what the impact of referring to health myths as outlandish or ridiculous might mean to those who we want to view us or our organizations as health information authorities. So I invite you to take a quick second to just think of one health myth that you might carry with you, even if you know it's not true as a scientist, as we continue on with this presentation. Next slide. So we're experiencing a historical moment today. The world now has more internet users than people with access to essential health services. And it's a world where over 80% of internet users search for health-related topics online. Next slide. Thank you. At the same time, clear examples of disparities in healthcare lead to grave consequences, which we know are disproportionately affecting queer communities and communities of color. And we know that disproportionate access to information, access here, we're talking about access in its broadest sense, accounting for barriers to accessibility, language constraints, content relevance is actually important to communities. These can exacerbate the negative impacts of the health misinformation that reaches these communities we want to target through their social media feeds or through, as many of us on this call might be familiar with, family text messages, or through content searches online when we use particular keywords. Next slide. So where audiences search and the information that they're able to find depends on the internet availability or digital resources that they have access to. For example, if an individual only has access to the internet through Facebook's Free Basics program, which is a collaboration between Facebook and key mobile providers around the world, it means they can only access select information and not the World Wide Web. So it's important to consider if we're meeting health literacy needs where users are able to access information in the first place. And if they're limited by language or literacy barriers, their search queries in a place like Google can yield results that don't align with the nuanced language that's often used by our community as public health authorities. Next slide. So today I'll be focusing on 4 key challenges related to effective health misinformation response and how they're being addressed with technology companies at the scale of the internet. Finally, I'll also talk about where the public health literacy community can create and supplement to improve health literacy and health access on the web. So I'll discuss gaps in community level information, unmet language needs, challenges in responding to misinformation or the misunderstandings or misrepresentations that we see right now through COVID-19 based on emerging scientific evidence, and community spread through our social media networks. Next slide. So the current COVID-19 information crisis we know has only centralized the importance of effective collaborations between health authorities and actors in the technology community. And these collaborations can only be strengthened by the involvement of an extremely important stakeholder, which might be new to many members of this audience, in driving forward health communications in the digital information ecosystem, specifically in collaborating with technology actors. And these are fact-checking organizations. Next slide. Fact-checking organizations have been around for a while. They've existed since the early 2000s. Many may know of them through their work in investigating political misinformation or fact-checking political claims. Some examples of organizations that have done some amazing work in this field include factcheck.org in the US, Full Fact based in the UK, Africa Check and PESA Check working across the African continent. And there are hundreds of other fact-checking organizations around the world who are working to address the misinformation and the disinformation affecting their communities. There's one really important standardizing body, the International Fact-Checking Network, that ratifies these organizations to promote best practices and a code of principles that fact-checkers use, and they can become verified signatories. And these fact-checking organizations and their certification by the International Fact-Checking Network is incredibly important for promoting and pursuing health literacy for a number of reasons. And one is their ability to work in direct collaboration with tech companies in responding to misinformation online, an incredibly important stakeholder collaboration for responding to the dangers of health misinformation on the internet. Next slide. So fact-checking organizations are the local actors that respond directly to the questions and the misinformation circulating in their own countries and in their own communities. And in doing so, they improve equitable access to health information, and their methodologies and the publication of their methodologies, which is very common for them to share when conducting fact checks, is really important to promote an understanding of health literacy and how that fact-checking process takes place. And what I argue is most important about their role is that fact-checking organizations unpack the claims or pieces of misinformation within the community context that are being shared. They're members of the community that are responding to misinformation that's affecting their communities. And with that lived expertise, misinformation responses are both relevant and accessible to the communities that they serve. But one issue that the fact-checking organizations are often limited by is the information or expertise that's available to them. So if they can't access a public health expert to comment rapidly, misinformation can spread faster than they can address it. Or if a certain type of health expertise is not available, then that type of content may not be fact-checked for a community and can lead to further health information disparities. The important role of health communications and public health literacy experts at this point is to contextualize the latest science in ways that are accessible to fact checkers so that fact checkers can make it accessible for their communities. And as I mentioned earlier, filling this need is the goal of the Public Health Expert Database and Toolkit project that my team at Medan is working on to respond to COVID-19 misinformation. So we field questions directly from fact checkers, and we rapidly turn around responses to contextualize the science to them in over 7 languages. So what you see in, sorry, if you don't mind going back to the previous slide, the 2 images that you see here are pulled from the database at learnaboutcovid19.org, where we have detailed pages to accompany each data entry, as well as visuals designed if fact checkers choose to accompany their work with such assets. And having access to experts is so essential, and fact-checking organizations can truly benefit from stronger partnerships and research conducted by the health literacy community. Thank you. Next slide. So why do we focus on fact checkers? It's because technology platforms around the world are already working with these fact-checking organizations in order to address misinformation on those platforms, either through finding new information pathways to the audiences that fact checkers have, or using fact-checked information to inform the algorithms or the systems that different platforms use to determine what content gets shared with an internet user either first or later or never. So WhatsApp, for example, is working to address the challenge of information accessibility for communities. And they're working with fact checkers directly by enabling the creation of text bots. I'm not sure if folks saw the bot that the World Health Organization created to improve access to COVID information. But some of those recommendations may not be directly relevant to communities who, for example, don't have 20 seconds worth of running water every time they need to wash their hands. So fact-checking organizations have created their own to provide contextualized information to audiences, and also to receive back through WhatsApp questions from their audiences about content they want fact-checked. And what's really interesting for the health literacy community is that these questions that have been shared by their audiences have provided some really fascinating insights about the discrepancies between the information that individuals need or ask questions about and what's actually published by health information authorities online. And these insights can definitely serve as an opportunity to improve the health communications field. Next slide. These insights can also be used when addressing the second challenge, linguistic sensitivity. So we work to prioritize content and make sure that it gets localized and not just translated, to make sure that the language and the content is culturally relevant and culturally sensitive. Next slide. To address the challenge of mid-information, those representations based on emerging scientific evidence, it's important to make sure that the information that users see first when they search online is the information you want them to see for a given point in time. So Google has created different pathways through which fact-checking organizations, as you can see in the images on the right, help inform the content users actually encounter. Google's built annotation tools so that fact-checking organizations can make sure that their content is surfaced when key terms are searched for on Google. And you can actually visualize the fact check as you do in the slides, the images rather, on the right side. Next slide. Finally, to address the challenge of community spread, Facebook has also partnered with fact-checking organizations so that when these fact-checking organizations identify a piece of content as false and flag it to Facebook, Facebook can integrate this information into their own content systems to hide or reduce the ability to view a particular piece of misinformation, which significantly reduces its distribution. Next slide. With fact-checking organizations so central to many search and social media platform responses to misinformation, it's a really huge opportunity for the public health and health literacy communities to get involved. Acting as a resource to fact checkers, supporting their work, advocating for their work to keep their communities informed, and to contribute to these technological processes that I mentioned to address misinformation at the scales required to respond to content on the internet. Next slide. So I've summarized some of the challenges that we've went over through this presentation and solutions here. And I know that these slides will be available after the presentation. Next slide. And for more information about additional opportunities that the health literacy community has for working with existing technology responses to health misinformation, here are some additional recommendations. And please do reach out with any questions, any thoughts, or any ideas for collaboration. This is a community that's really excited to get more involved with public health and health literacy. Last slide. Thank you so much.
Thanks so much, Nat. That was terrific. And the slides will be available, and there's some terrific resources that you've included on there. And folks have an open invitation to reach out to you directly, so get ready. So thanks to our first two. I'm going to turn to my dear colleague here, Lori Myers, and let her continue our conversation. Thanks so much.
Thank you, Ruth. Start the video. Okay. Hi, thank you so much. What fantastic discussion so far. So in the next part of this panel, we will focus on other ways to address the problem of misinformation. I'd like to introduce the next panelist, Bryony Swire-Thompson. She'll be addressing the psychological component of what drives belief in misinformation and the science behind strategies to correct misinformation. Bryony is a cognitive psychologist. She investigates what drives belief in inaccurate information, why certain individuals are predisposed to refrain from belief change even in the face of good corrective evidence, and how corrections can be designed to maximize impact. She's a senior research scientist at the Northeastern's Network Science Institute and a fellow at Harvard's Institute for Quantitative Social Science. Prior to joining the Network Science Institute, she was a doctoral student at the University of Western Australia's Cognitive Science Laboratories and a Fulbright Scholar at MIT's Political Experiments Research Laboratory. I know you're going to really enjoy her content.
Hello, thanks so much, Laurie. If you could just progress to the next slide, please. Oh, okay. I feel like this could be the different slide deck, but I'll see how we go. As Laurie mentioned, my work primarily focuses on the correction of misinformation. I've worked with generic myths and facts, and political misinformation, and more recently health. So I think health is unique for a number of reasons. Firstly, health mis and disinformation in particular can thrive because there are these significant financial incentives that aren't necessarily there with other topics of misinformation. I think it also has these particularly severe consequences with regards to quality of life and risk of mortality, which make, I think, health misinformation quite concerning. Next slide, please. Oh, okay, great. Okay, so I think when it comes to COVID, it is a bit of a perfect storm here, not least because it takes time for science to establish what is true. This means that fake experts can speak with more certainty because, of course, they're making information up. And when you do so, you don't have to couch everything in the nuance that often comes along with the true information. Secondly, I think everyone is quite desperate to get their new research out and public and to read information. I think this could potentially lead to real scientists posting preprints. And there's a lot that can change between a preprint and a published outcome. And I think that sometimes, for example, journalists might not realize the difference between these very new scientific findings and like an established published end product. I also wanted to highlight predatory journals could be a large problem. I think they're a problem in health in particular, but particularly when it comes to COVID, where there's this real need to get fast information out there. But these are journals that accept publications for monetary gain, and they don't have the traditional editorial processes that ensure or try and ensure that accurate information gets out there. Oh, yes. I hope, can we progress to the next slide, please? I hope. Okay. There were some slides in here. I think these are the slides I was going to post online. There were some slides in here regarding is it too late to get those old? I would totally expect it's too late to grab those other slides. I deleted them for, I didn't want them. Okay, super. One sec. So what you're about to see, I believe, is an example of misinformation from a journal that has been indexed by PubMed, which is, I think, a particularly scary thing. And it is essentially information that is claiming that 5G causes coronavirus. It's particularly problematic because it's also, you can find it through, if people were to post, to search in Google Scholar, they will get this, and it looks like a very official publication. It's also okay if we can't find this. I can just keep talking and just progress as usual. So essentially, what I was hoping to highlight with those slides is that how much health literacy are we really expecting individuals to have when this is a more structural, this is a systematic problem that actually allows seeming, this misinformation to, here we go. Fantastic, thank you. Okay, so here we go. Here's this example. It's, as you can see, if you progress to the next slide, actually, you can see a clip here. So this publication, it was posted on the 16th of July, and it states that 5G waves can be absorbed by these cells acting like antennas and producing coronavirus in biological cells. And I wanted to highlight this because this is such a dangerous example of very blatant, very clear misinformation that has been, if someone has a good level of health literacy and they have searched in these very good places to look for information in general, PubMed, Google Scholar, this is what they might find. So I first think that we need to teach people in health literacy courses about predatory journals and the difference between really seeing the legitimacy of the journal, but we also systematically need to kind of tighten these a little bit more. If you progress to the next slide, you'll actually see that it was retracted. There's an organization called Retraction Watch, which is very helpful. And this was retracted on Sunday. So this is incredibly new. However, the problem is, if you go to Google Scholar, it still shows up like this. And if you click through, there's nothing there, but I think this is potentially incredibly dangerous for spreading misinformation. Next, please. So talking about successful strategies, I think can be sometimes difficult in this field because, as Kate mentioned, this is really new. Like, we're a really young field. We have some recommendations, but because this is misinformation is such a new science, it could well be subject to change. Next, please. Okay, so there is evidence to suggest that critical thinking is a skill that can be taught, but gauging the efficacy of some of these literacy programs can be quite difficult, and findings have been mixed. Another thing I would like to highlight, next slide please, is that there's converging evidence that it is, previous slide please, is that there's converging evidence to suggest that it's older adults that share disproportionately more misinformation online. So if we're thinking, we have to think a bit more about where we're implementing these health literacy strategies. If people over the age of 65 are 7 times more likely to share misinformation online than those 18 to 30, teaching students in schools or even university isn't going to do much for the entire ecosystem online, if this is where the strategies are being focused. Next, please. Okay, so when it comes to actual tips for correcting misinformation, the first one would be provide factual alternatives. So if you can say, well, here's the misinformation, it's not this, it's this other thing. Next slide, please. The traditional example of this comes from when, next slide, is that possible? Next, so, okay, this is progressing a bit fast. Can you go back a bit, please? Okay, there you go. So the traditional paradigm is where you present people with a fictitious scenario. You present participants with a scenario, you say the reason for this warehouse fire were gas cylinders that were in a cupboard. Then if you retract this core piece of information and say, that's not true, that's misinformation, it leaves this gap in your mental model. And the best thing to do is to fill it. So next slide, this is where the little match comes in. That if you say to people, it's not the gas cylinders, it's arson, people are much happier to update their belief. The problem, the big problem with coronavirus misinformation is so often we just don't know the alternative. And also another catch is that alternative has to be as simple as the misinformation, which is just sometimes, or often the case, is the truth is more complicated. Next, please. Providing warnings if misinformation will appear is also very effective, but it's hard to do this if you're not in charge of the presenting both the misinformation and correction. Next, please. Repeating corrections works is effective as well, and I think this is some evidence towards what we believe to be true is what we remember to be true. So don't be concerned about repeating the corrections multiple times. And this is what leads to my final point. Next, please. Is this paper is in press as we speak, which is about backfire effects. And this is a topic that I hear incredibly frequently in these kind of workshops or in conferences. Next, please. So a backfire effect is said to occur when you present an individual with a correction and they end up digging their heels in, strengthening their belief in the very misconception that you are hoping to rectify. And a lot of people are very concerned about this, and I did want to highlight that this is not a robust empirical phenomenon. And what I mean by that is that it hasn't been replicated, or when you follow these citation trails, the original paper which is positing this doesn't have strong evidence to begin with. And I'm going to end also on this point next, please, of if you've ever heard the recommendation of don't repeat the original misinformation when you're correcting it, this is not true. It's being, I think, confused with another phenomenon. So the phenomenon that does exist is called this illusory truth effect. So this occurs when information is repeated, but there's no correction involved. And this, if information is repeated, it does become more familiar, and people are more likely to believe, to think that familiar information is true. However, as soon as you pair it with this correction, this does not happen. So feel free, because if you don't repeat the original misinformation, often people don't even know what you're talking about or what you're trying to correct. But it's very important that you always clearly and saliently pair this correction with the original misinformation. I think if we're going to, there's one takeaway from this presentation. Next, please. It's that, next slide, please. On the whole, people are actually quite good at updating their belief. It's a really positive story. When they read corrective evidence, on the whole, people are, from all of my research, incredibly good at updating their belief. So those of you that have, even on social media, with large followers, you can use this as a platform to really correct misinformation out there. Yes, that's the end of my talk. Thank you very much. You can fast forward if you like.
Okay. Thank you very much for this wonderful discussion, Bryony. I'd like to switch gears now and focus on potential health literacy strategies we can use to address health misinformation, and I'd like to introduce Sylvia Joe. Dr. Sylvia Joe is the Program Director in the Health Communication and Informatics Research Branch at the National Cancer Institute at NIH. Trained in sociolinguistics and public health, Sylvia has expertise in qualitative and mixed methods approaches. She's led a number of NIH initiatives on the role of technology and social media in various areas of health. Dr. Chow has more than 75 scientific publications, many of which have documented health-related internet use, the impact of social media on health communication, health literacy, and the cancer prognosis and goals of care communication. So without further ado, I will turn it over to Sylvia.
Thank you so much. Can everybody hear me? It's good?
Yes.
All right. Well, it's an honor to be on this panel and share some of my thoughts on this topic. So at NIH, I've been a part of several health literacy initiatives and funding opportunities opportunities. And I think one observation, most of you will agree, is that there are diverse definitions of health literacy and different understanding of its role in communication. And with this new sort of ecosystem and the rampant spread of information, I think it further complicates how we develop and deploy health literacy strategies. So from the onset, I think it's just important to acknowledge that, you know, when we say health literacy, it may mean very different things to different people. So we can go on to the next slide. For the last 3.5 years, our team has been really working towards crafting a research agenda on addressing health-related misinformation, so well before COVID-19. And so some of it results in publications, and one exciting one I'd like to highlight is the upcoming publication in the American Journal of Public Health, a special issue, a theme issue that's focused on health misinformation. And so to do all this work, I think we need to start with some definitional work. So we've tried a lot of different ways to conceptualize misinformation. Here is just one of the most current definition: a health-related claim of fact that is false based on current scientific consensus. Now, that is a definition that's very focused on the statement, right? It's not really looking at the context. And I think as we see from even the presentations before me, it's very important to consider intent. Is it to sow division, to generate profit, to create chaos? And when we think about impact, a piece of COVID-19 related misinformation that gets people to drink juices more is very different from ones that get people to not wear masks and socially distant. And also the medium and the sort of the way social media and the information silo maybe creates how such information is shared is also important. So that's what I'm going to spend just a few minutes talking about. Next slide, please. To start, I think there are a few things the literature has been more or less established to tell us about how misinformation spread. Here are just what I can come up with that I think we have more, at least still growing, but some evidence. Divisive disinformation campaigns erode consensus, or the sense that there are consensus in the scientific literature, and also erodes trust in experts. Online echo chambers perpetuate these divisions. Falsehoods tend to spread easier and faster. Credible information is often complex, nuanced, evolving, and uncertain. And these are important things in communication. Anyone who has done work in health communication can attest to the importance of source, format, and health literacy of the community or the audience we're communicating with. And we know that social media industry, as we can even see today or in everyday's headlines, that industry and government's policies and practices towards misinformation and content moderation are rapidly evolving. Please, next slide. So I thought it may be helpful, we can move on to the next slide, to come up with some kind of a working taxonomy. And I invite the audience to think about what I'm not considering or ways we can think about this better. But I came up with, the idea of taking stock of the kind and the topics of misinformation about COVID-19 is a hard work, because it comes at various, some people liken it to like a game of whack-a-mole. You know, they come up, they disappear, and they re-emerge. So I came up with these sort of 6 buckets. Overall COVID disease characteristics: either complete denial of the pandemic, downplaying the susceptibility and disease severity, or linking unsubstantiated symptoms to COVID-19. We know there's a lot of misinformation about the origins and the spread of the virus, from conspiracy theories linking Bill Gates' Chinese lab, 5G, to certain stigmatized cultural practices, to also federal, state, and local government and organizations' responses, especially related to quarantine and stay-at-home orders and policies, and vilifying certain public health professionals. And the right column, I think these are more individual specific behaviors, whether it's social distancing guidelines, mask wearing, or the use of unproven treatments such as home remedies or unproven drugs. Hydroxychloroquine, again, resurfaced in the news this week, and promoting dangerous products. And finally, when COVID vaccine is finally developed, related misinformation about vaccine generally and especially about the development of COVID-19 vaccine. So next slide, please. And with that, I'd like to sort of take the COVID vaccine as an example to talk about what I see as more traditional health literacy approaches and how, in light of misinformation, we may need to think in some new ways about how to deploy health literacy approaches. So I would think intuitively that we currently live in a world without vaccine. So where we are, we would normally be meeting in person in such roundtable activities, and just the fact that our life, is the way it is because we don't have a vaccine, would be a sort of easy place to think about encouraging vaccine uptake when one becomes available. So if you go with that thinking, then traditional health literacy approaches would include proactively promoting vaccine literacy, such as doing interventions in targeted media campaigns or tailored peer-to-peer school-based, community-based vaccine education to provider-patient communication. And one of the sort of suggestion is to have strong and consistent messaging from the vaccine literacy literature. In the meantime, these are the traditional approaches we have in our pockets, but we need to think about strategies that are already being deployed by anti-vaccine groups. And we know that the way, if you understand these strategies, they can't simply be undone with correction or fact-checking alone. So things like propagating rhetoric related to personal freedom, and I think Kate gave us a great outline of just what it means to spread disinformation by leveraging these things like certain values, feelings, emotions, and also discrediting agents involved in this vaccine development, to targeting already mobilized and highly emotional topics, such as racial justice movements and abortion controversy. So going to these places where there may be already a great deal of mistrust, distrust, and then sowing misinformation about vaccine in those communities really make the spread of these type of messages so much more effective. Can we go to the next slide? So I think here are some strategies that may be worth trying. There's not a lot of good established literature on sort of their efficacy, but I think these are worthy targets. Can we induce skepticism towards disinformation agents? Similar to the ways, like the Truth campaign that aims to discredit tobacco marketing tactics. To thinking about tools that can help identify and sources that are credible, and also resources for debunking myths and misinformation. We've heard some examples of that on this panel. Cultivating science literacy to help people understand that uncertainty and evolving nature of science is part of how we understand health and science. Combating conspiracies by thinking about how to partner with maybe former members of these groups or online influencers, to mobilizing the majority, of people who are maybe more supportive of vaccine uptake. And the last one is one that we're witnessing every day in terms of proactively monitoring, flagging, downranking, and removing content. So I think altogether, and these boxes are just, I think, important players in this space. These efforts can help address cognitive, emotional, social, and contextual factors of misinformation spread. So next slide, please. And this is a very exciting study that my lab at NCI is developing or planning. And we're hoping to do a randomized experiment to look at the use of storytelling and narrative-based messages to promote recommended behaviors on COVID-19 related behaviors. So we're going to be using MTurk. We're going to assess attitudes, beliefs, and behaviors at baseline, and then giving people congruent messages, one in a personal experience narrative format and one in a non-narrative didactic format, to see which one is more effective at either changing or just changing attitudes and behaviors. So next. So that one, this one we don't have results yet, but I think similar research endeavors can be very helpful to really help health literacy and health communication field to know how do we deal with misinformation. So my final slide is really my sense, how do I say this? So I think the priority for us is to put health literacy in context. So health literacy doesn't exist in a vacuum. It's not just about providing good information or filling in the gap where there is lack of good information. We need to consider the role of technology, identity, values, biases, and emotions, and learn from examples of successful or effective communication. So in closing, these are my sort of 3 places where I think health literacy approaches or interventions are ready to be deployed, but that they need to be done in a different way. The first is to think about digital literacy. So it's not just a matter of discerning a piece of health information. It's about fostering fact-checking skills and the awareness of these algorithms and techniques to make you want to click on something or share a meme that gets you really excited or angry, or just, these sort of technology algorithms that, encourage the spread of misinformation, I think needs to be part of the health literacy intervention. The second one is, I think we need to redefine what is meant by vulnerability. So traditionally, we think about limited health literacy either in terms of limited English proficiency or limited education. But I think vulnerability has taken on a new meaning and need to think about, are you in some kind of online information silo? Do you have a conspiratorial mindset? And we need to think about doing health literacy interventions that penetrate silos. And lastly, any health literacy efforts need to consider the role of trust, and how can we foster trust and restore trust as part of any initiatives. So sometimes if we just promote a piece of information like hand washing or mask wearing, we don't think about what that means in terms of the implications on the trust we are or are not building with our audience. So I think that is one area that may be ready to be incorporated into other health literacy considerations. And I'll stop there. Thank you.
So I have just learned so much from all 4 of you, and because of just the innovative content, we've made a change in the last 5 minutes in how we're going to run the last few minutes. So we think that it would be really important for each of the speakers to reflect on what they've learned and how it relates to one another for just a moment or two. I think the message that I heard loud and clear is I had seen on many of the questions just this frustration, this feeling that misinformation is not something that we can move. And I think the number one thing I took from the speakers was optimism, that in fact there are tactics, there are ways that we should be thinking about combating misinformation, and there's so many resources that have been shared here. I think another theme that I heard in the questions from the audience members that was echoed here was the important role of so many players in the health system. So obviously people hear from an IT lens, from other perspectives, but also the role of the importance of fact checkers and journal and media and clinicians and combating misinformation, and that this is not something that any of us can do alone. So while they're sort of high level, I think that those are really, really important, hopeful takeaways. Maybe now we'll go back in order of speakers and just reflect for a moment or two to begin. So I think, Kate, that would go back to you.
Sure. Yeah, I mean, there's just been so much great content and to see how these different pieces tie together. And I'm going to go back and rely on the things that I know the most, but try to pull up a few things that I heard today that I think are really important and connect them. And I think as we look at this problem that we have to address it from multiple perspectives. We have to address it from health literacy, education. I think the platforms themselves, the social media platforms that are facilitating a lot of the conversations, they need to make changes, and they are making some, but they need to continue to make changes to help with these as well. I think there's a role for government and policy. I think that's going to be complicated, and we have to think about the implications of that. But I do think that this is a sort of all hands on deck kind of moment, and that this problem is very complex and we need to solve it from multiple directions. A couple of the really interesting things I heard, I know Bryony was talking about the backfire effect. And I have been so frustrated with the research on the backfire effect, and so happy that we've come around and decided that is not the path forward. Because for years we were telling people not to correct other people online, and I think proliferate. And we were telling journalists not to talk about it because they might amplify it when they were correcting. And I think we were really giving the wrong advice, and we let this stuff fester at the edges, and then it began to move into more and more conversations. So I think it's really important that we start developing and spreading new norms around correcting ourselves, around correcting others, with empathy, in ways that don't call people out and say, oh, you're a bad person. No, misinformation is spreading. Everyone's making mistakes. How do we help ourselves, train ourselves to correct our own mistakes and also correct other mistakes? I think there's really some room for, again, developing and communicating these new norms. And I really love that last, not the last slide, it was like a third to last slide about communicating. I left it in the notes for myself, but I can't find it, of course. But considering novel communication strategies by Sylvia, I think there's some really good ideas there. And one of the things that I didn't bring up in the disinformation conversation, but was in my notes, and you kind of hit on it, is this intersection between disinformation campaigns and authentic activism. And we're seeing that in the anti-vaccine space, but we're seeing other activist groups and politically motivated groups kind of get targeted to become vectors of mis and disinformation around health and COVID-19. And that's something that's really hard to address, but it's something to think about. How do we help activist communities protect themselves from these kinds of cultivations and infiltrations by people that have other motives? And again, I think it's about education, but it's also about platform design and platform policies. And I think we need to work together holistically across these different sectors to address these problems. I'm done. And I'll pass it on to the next speaker.
Matt, I think that's you.
Yeah.
Yeah, absolutely. I think Kate, what's the saying? Hit the nail on the head, I believe it is. Hit the nail on the head with a lot of those conclusions. I'd love to add that I think that the tech community has learned a lot from the public health community about communications, about intervention design, about controlling for factors and populations, and understanding that there's nuance in the populations that we're trying to target. And it's only our hope that in coming to this discussion from the public health, technology, and psychology sectors, that we can work to create more kind of interdisciplinary solutions. We all come with such different perspectives. And this is, I think, one of the most interdisciplinary fields I've ever come across is the field of misinformation. So the fact that there is an opportunity to truly learn from one another, and that the NES has created spaces like this where we can have these types of open conversations, I think is really important. That's all I have to add. I think to Bryony.
Yeah, absolutely. I'd like to, echo what both Nat and Kate have said, in that I think firstly, this is such a complex problem. It needs to be addressed from these different angles. And I also think that, the science is impacting the policy and vice versa. And I think that it's such a complex web, whereas it's like, I think an example that springs to mind, again, from the backfire effect, is when I heard that funders were threatening to pull their funding from fact-checking companies due to the science on the backfire effect. And I think like it's incredibly dangerous. Like if we don't have fact checkers, if there's not something to pop up when someone like puts in a search term of a piece of misinformation, I just can't, that would be a really negative consequence. So I think, both researchers have a, responsibility to do the best science they can. And I think, the platforms have a responsibility to, make changes that make sense for a factual evidence-based world. And I just think like everyone, in a way has to do their part. And I think we're, never before have I seen I think everyone's just jumping on the bandwagon in a good way. Like this is definitely, I think people have really woken up to that this is I think scientifically it's both an interesting problem and one that is kind of desperately needed as well. So I think it's a luxury.
Sylvia.
Thank you. I mean, it's a very sobering moment. I mean, we have 150,000 or more deaths already, and things aren't getting better. So I feel like from a perspective as a public health practitioner and someone who cares about communication and who cares about health literacy, this kind of conversation where we bring in novel approaches. I mean, we have nothing to lose if we don't, we need to try something different, right? So I think traditional health literacy approaches have worked for certain things, but we can tell it's not working in this world of information ecosystem where we used to be so happy to hear about the democratization of information. And what it's brought us is this idea of this cacophony of voices and opinions that are very, very hard to mitigate the effects of, once you're exposed to. So I think if one thing is that we can't remain naive, I think misinformation is obviously not a fringe topic, and we need to work together. The people who study misinformation and disinformation need to be at the table when we are designing public health campaigns and messaging, so that we don't talk past each other and have this problem of great information that's not accessible and used, and then continuing to have these problems of misinformation gaining grounds because they tap into people's feelings and emotions and they're already made effective. So that's what I have to say.
Finally, Ruth.
So thank you all so much. I have to echo where Laurie began with, it's a hard time, but you all give me some optimism. And I really appreciate, your thinking, your research, the work you're doing, the collaborative spirit that you bring forward. We need you. And so thank you for what you're doing. I always go back in my mind to thinking about health literacy and the conversations we've had for years about it being both content, which we've done a lot of work on, and also context specific, that being sort of fundamental to how we saw it. And I think that this conversation really helps underscore the content, absolutely, yeah, but that context and the emotions and the role that they play. I think you really, have sort of brought that to bear in a lot of the discussion that we had. And for me, I'm hearing some new horizons for health literacy. So I get kind of excited about that. I've been around this thing for quite a long time. So it's very exciting to think about the next generation there and the kinds of work that are on the horizon and the kinds of people that can be engaged in it. Kate, your comments underscore for me, this is real. It's actually dangerous. This misinformation, you're not saying this might be out there. You're saying this is out there, guys. How much of it? Probably more than we want than a lot of us even really know about and think about. And so I really appreciate just, you're highlighting that this is a real thing and we've got to pay attention to it because it's actually dangerous. Nat, I love about this idea that fact checking is probably a new horizon for health literacy. It really, the role of having people who understand health and public health and the various entities that are a part of that. There's a seat at the table there collaboratively. And so I think that's a really important new horizon for the field. Bryony, I'm very excited to know that because I think certainly my children, among others, would say that I do repeat corrections repeatedly. And so you've reassured me that that's not all time wasted, and I have a small amount of faith in my humanity around me that people are actually good at updating. And so go humans. And so let's keep updating and not forget that's actually empirically grounded. So thank you for that. And Sylvia, the taxonomy you gave us for thinking through something complicated was incredibly helpful. And I appreciate that you put that out there and that you underscore for the roundtable and all of us, health literacy doesn't live in a vacuum. That's a great one. It doesn't. And there's a lot of work. I also appreciated the repeated echoes of the importance of trust, and that trust is really foundational. Just like accessible, understandable evidence that's the best that we have available that does get updated, making that something that is there, but also doing what we can to build trust as something that is truly foundational to our individual and our collective lives. So thank you all so much. Again, to Rose and to Alexis, we appreciate the opportunity to put this out for others. You all heard from some folks that I'm going to call them the hope of the future, and they've said reach out to them with your questions and your thoughts, and I would encourage you to do that and to keep this thing moving forward. We need it. So thanks so much for the opportunity. It was great to be with you.